chakras. And we go to so verification. Start with the current slide. Is it full screen for you?
No, ma'am, it's not full screen.
I see.
It's visible.
Yes, ma'am.
Okay. Now let us start listening to the doctors and take notes about each patient in your table.
Unit 9. Listening.
Can you hear?
Yes, ma'am.
Unit 9. Listening. 1.
Mr. Jones had the appearance of self-neglect. He did not appear to be paying attention to what was being said. He looked as if he had withdrawn completely from his surroundings and was preoccupied with his own thoughts, with no eye contact whatsoever. He sat hugging himself during the interview. He did not interact much with the nurse, nor look at anyone else. He left me feeling in quite a low mood myself.
2.
Although Miss Rigby is in her late 40s, she wears really bright clothes, which are suitable for someone much younger. When she was admitted, she was in a highly elevated mood, hyperactive, and was awake all night. Her thoughts are all over the place. She did not appear to be aware of anything abnormal in her behaviour.
3.
Mr. Dixon was well dressed, but looked very worried and anxious. He sat on the edge of the chair, was quite agitated, and couldn't sit still. He was fidgeting all the time and had very poor concentration, though he looked at me when he spoke and was spoken to. I felt safe with him, but a bit nervous after the interview.
Now let us listen for the second time, just to understand all the details.
Unit 9. Listening. 1.
Mr. Jones had the appearance of self-neglect. He did not appear to be paying attention to what was being said. He looked as if he had withdrawn completely from his surroundings and was preoccupied with his own thoughts, with no eye contact whatsoever. He sat hugging himself during the interview. He did not interact much with the nurse, nor look at anyone else. He left me feeling in quite a low mood myself.
2.
Although Miss Rigby is in her late 40s, she wears really bright clothes, which are suitable for someone much younger. When she was admitted, she was in a highly elevated mood, hyperactive, and was awake all night. Her thoughts are all over the place. She did not appear to be aware of anything abnormal in her behaviour.
3.
Mr. Dixon was well dressed, but looked very worried and anxious. He sat on the edge of the chair, was quite agitated, and couldn't sit still. He was fidgeting all the time and had very poor concentration, though he looked at me when he spoke and was spoken to. I felt safe with him, but a bit nervous after the interview.
Okay, so we will listen to the doctors now. What kind of notes have we made? Let us listen to. Is Rohit here? No. Ritik, please, about Mr. Jones.
Yes, ma'am.
Mm-hmm.
When the patient is self-neglected with no eye contact, and the manner of the patient is like he's not paying attention to the doctor, and their mode of speech is very worrying. She's like he's like hugging himself during the interview,
Mhm.
and he does not interact with the nurse or doctor in the department or in the room, and she's feeling very in quite a low mood.
Mhm. Mhm.
Doctor also feeling worried or anxious about the patient, like he's in quite low mood after seeing this patient.
Mhm. Okay. Thank you. So everything was mentioned. Can we add anything to this information?
Yes, ma'am.
Yes.
He's preoccupied with his own faults and does not interact with the nurses or patients in her speech, and she is not paying attention at all to the
Okay.
doctor,
Yes, you've said
uh,
it. Mhm.
and in the very shabby clothes, or we can say very dirty clothes.
Mhm. Okay, good. So this is about Mr. Jones. Now about Miss Rigby. Let us listen to Mocht. Is Mocht here?
Yes, ma'am.
So, what do you remember about her?
Ma'am, if you talk about the appearance of Miss Rigby, so ma'am, she wear the bright colors and she is in 40s, and like ma'am, if you talk about ma'am, like she's like something like angry and in her elevated mode. And if you talk about the mode of speech, so ma'am, she's not interacting with like nurse or anything like doctor.
Mhm. What about the inside?
Ma'am,
You
Ma'am, if
remember?
you talk about the inside, so like she feel normal behavior,
Yes.
but the doctor feel, ma'am. But if you talk about a doctor's feeling, so ma'am, doctor think she is not abnormal, so she is not well, or she is look like abnormal condition.
She has some disorder.
Yes, ma'am.
Okay, thank you. And now it's Aman's turn to speak about Mr. Dixon. Aman?
Yes, ma'am.
Mhm.
Ma'am, Mr. Dixon is very well dressed. And what eye contact is, it seems he seems to be worried, and
Mhm.
manners was like he couldn't sit still, and he was just very unstable. And mode of speech is poor, and poor connection, poor communication skill, insight. Uh, I don't know about insight, but doctor feelings. She was feeling very safe with the patient.
Mhm. But after the interview, what does the doctor say? She so felt safe, but
Little nervous.
nervous.
Little nervous.
Nervous, yes.
Nervous. She was nervous.
He is quite agitated and having poor concentration.
Right. And so he was sitting on the edge of the chair, so that also characterizes him. Okay, thank you. And if we we've learned something about these patients, and
Unit 9.
what is likely diagnosis in each case? So
Ma'am, in the
about
first case, may I?
the first case, Mr. Jones, what is the name of the disorder?
It looks like depression.
Yes, because
it also can be withdrawals.
uh, so look, we're speaking about these disorders like mania, psychosis, depression, and anxiety.
Okay. It can be anxiety then. It can be
So,
anxiety.
Mr. Jones, this is depression, actually, right?
Depression.
So, in the
Ma'am,
second case with Miss
social
Rigby,
communication disorder, maybe.
Mrs.
Mania.
Rigby.
Miss
This is
Rigby
mania.
had mania.
Anxiety.
Mhm.
Mania.
She's anxious.
Anxiety.
So this is mania. And Mr. Dixon,
Anxiety.
anxiety.
Ma'am, he does not,
Anxiety.
Okay, so does everyone agree with this diagnosis? Okay, well, yes, and now
Unit 9.
I would like you to, yes, so we are going to work some information about psychotherapist, Dr. Tom Turner. So about the ways of dealing with the psychiatric patients. And just before we start reading, we should look at the list of the skills which are necessary for psychotherapist. And there are 8 skills here mentioned here on this slide, and we should think and choose only 5 skills, the most important skills for psychotherapist. So please, what skills should the doctor have?
Ma'am, may I?
Yes, please.
In psychotherapy, like for psychiatrist doctor, he should be using sympathy and empathy.
Mhm.
Second, first foremost, he should be listening to the patient.
Okay.
Second is using his sympathy and empathy and letting time run its course.
3.
And stopping
Yes.
oneself from making judgment about the patient. This is the main.
And one more, please.
Knowing how to use one's own daily life skills, because
Okay.
it depends particularly in the patient, because if the patient's daily life daily routine has been affected, then it is important to know how he is using his life skills daily.
Yes, he should adapt to the to living in society among people. Okay, so it's clear we have chosen 5 skills. Now let us just read what the doctor says himself. And here's the beginning of the article, and let us listen to Apeksha. Start reading, please.
Yes, ma'am. Reading Dr. Tom Turner. My name is Dr. Tom Turner, and I have been asked many times why I choose psychiatry. I had chosen a period in A&E for my next undergraduate rotation when an opportunity to work on a psychiatric ward came up, and it seemed like an interesting option. So it wasn't something I had planned for a long time.
So he's speaking about his the beginning of his career in psychiatry. Well, this is for Misha.
Yes, ma'am. Now I work as a locum psychiatrist, which fits perfectly with my lifestyle. I have followed a range of courses and training in various areas of psychotherapy, cognitive behavioral therapy, and so on. But most important skills I think I have learned and that I have carried me through these years are those emphasized in my internship by my mentor and which still hold true today.
So he starts speaking about the skills. Okay, and now is Nivas here? Ram Nivas, hello, are you here? No. Manas, Vandana, please. Vandana?
Ma'am, Ram is here.
Yes, ma'am. Yes, ma'am.
Ram Nivas, are you here? Right?
Yes, ma'am. Yes.
So read it,
Yes,
please.
First of all, there is being able to allow time to help in the healing process for the patient, the family, and the doctor. Coming from the hectic life of my previous department, I now seem to be moving in another dimension. I soon found that impatience was not going to help me or the patient, and that the whole process began with the first contact through discharge from a ward.
So he's speaking about the change in his attitude towards time, actually, right? Well, and Vandana?
Yes, ma'am. Listening is another but no less valuable skill. I had of course done a lot in my training, but working on the ward impressed upon me the effect on the patient of just having someone taking time to listen. And through this came trust. Being non-judgmental as we listen to patients is another important technique, as otherwise there is a danger of patient alienation. Finally, there is the ability to use our skills of daily living, which we can reteach to patients as they prepare for discharge.
So I would look to be sure that we understand alienation. What does it mean? Patient alienation. So it comes from alien, right? And yes?
New, something which is unknown or new.
Yes. So if we speak in this context, this is like isolation of the patient, right? Okay, so here is this is the information about the skills necessary for a psychotherapist. And now let us listen. Let us look at the same just information, the same list one more time, and just summarize which 5 skills are mentioned by Dr. Turner. So which were they?
Ma'am, may I?
Yes, please.
Yes, ma'am. The first skill he mentioned was letting time run its course. Then the second one was listening to the patient. Then the third one was developing the patient's trust. The fourth one was stopping oneself from making judgments about the patient. And the fifth one was knowing how to use one's own daily life skills.
So do we all agree with this? Okay.
Yes, ma'am.
So yes, and surprise, he was not speaking about sympathy and empathy to the patient. And good. Now let us just speak a little about the grammar related to this article. So in the article, the Dr. Turner says, I have chosen a period in ND for my next undergraduate rotation when an opportunity to work on a psychiatric ward came up. So in this sentence, he uses the verbs had chosen and came up. So he uses 2 different grammar tenses. Came up, this is the past simple tense, and had chosen, this is the past perfect tense. And why he just used different tenses? Because so he's speaking about the past events, but came up was in the past. He came up to psychiatric ward, but had chosen shows that action happened earlier, before came up. This is the past simple. So the same is about the second example. It wasn't something I had planned for a long time. So this is the past action, and had planned before the action that happened before the action which is expressed with the help of the verb to be. So the rule, we should use the past simple and the past perfect tense to describe an event or period which happened before a point or period in the past. And so if we have a look at the next slide, we can see the information about the past perfect tense. So it consists of 2 parts, the auxiliary verb had and the past participle of the main verb, like here, chosen or planned. And when do we use the past perfect tense? The past perfect takes place before another past action, like in the example which is given here on this slide. I noticed that he had left his books behind. So I noticed that was the past action, the action that happened in the past. But he had left happened earlier. That is why past perfect is used here. This happened before. I noticed this. Priyesh, I see. And so this is the illustration that shows these the example, this is the timeline, and when we use the past simple, this is related to the past event. But if we speak about the events that happened before, we use the past perfect tense. They are normally used in pair, like just we can compare which action happened first and then which action happened later. Well, and so there are some expressions that are commonly used with the past in the sentences where the verb in the past perfect tense is used. You can say that these are the past perfect markers. Like after I had eaten, I returned to work. So after is a common expression. The shift was over by the time I had written up the notes. So first I had written, and then the shift was over. Then I had already left the ward when he arrived. So you know that already is the marker of all perfect tenses, and here in particular the past perfect tense. Or I fell asleep before I had finished studying, also before. And the next example, once I had finished washing my hands, I was ready to begin. So also once is also the time marker. And now let us have a look at the practical exercise. Here in these sentences, we need to use the verbs into tenses, the past simple or past perfect tense. And you can see that there are two verbs used in each sentence. So one of them should be used in the past simple and another in the past perfect tense. And we should just to do it, to make it, to use them correctly, we need to analyze the situation, and we need to understand which action happened first. So the first sentence says, Dr. Glover already finished his watch rounds when the consultant telephoned. So finish and telephone. Which action happened earlier? Hello? Hello, guys.
Yes, ma'am. Yes, ma'am.
Yes.
So, what was first, finish or telephone?
Finished.
Finish, yes. So if this action was earlier, so we should use it in the past perfect. So
had finished.
yes, had already
had
finished. When the consultant
Glover had already finished his ward rounds when the consultant was on the telephone.
When the consultant, sorry, will you repeat, please?
Telephoned.
Telephoned, yes. So
Telephone.
Dr. Glover had already finished when the consultant telephoned. Right, yes. So please look at the other sentences, analyze them, and just use the verbs in the correct form, past simple and the past perfect tense. Just 3 minutes to you to do this task. Start, please. Well, let us check what we've done. Priyesh, are you here? Priyesh?
Yes, ma'am.
So please read the second sentence.
Ma'am, the doctor rushed to the ward, but the patient had already disappeared.
The doctor rushed, had already disappeared. Right. Okay. So then, Sayonika.
I dash some assessment test before, so I dash what to know. I have done some assessment tests before, so I would know what to do.
So I
Knew.
knew.
I knew what to do.
Exactly. Yes, I had done. I knew. Okay. Now let us listen to Ritik.
Yes, ma'am. Mrs. Scott had very well known to the police, so they arrested her once before and had been brought her to the hospital.
Look, so there is the word before. So it means that the arrest happened before so before this situation which is described in the sentence, and it should be used in the past perfect tense, right? The same about bring. It means that we should use the verb to be in the past simple. What is the past simple of the verb to be? Mrs. Scott was. Yes, was well known.
To the police. They had arrested her once before and had brought her to the hospital.
Exactly,
And
yes.
had been brought her to the hospital.
Had brought, right. So the next please for Mocht. Mocht, are you with
Yes,
us?
ma'am. Yes, ma'am.
Number 5, please.
You make up your mind about your future career when you be at the secondary school. Yes, ma'am. You made up your mind out. Yes, ma'am. I will tell the answer. You made up your mind about your future career when you had been at secondary school. Sorry, you were at secondary school.
You were at the secondary school. What about make?
Yes, ma'am.
What about make? What is the form of make here in this sentence?
Made. You had made.
We should use one of the verbs in the past simple and another in the past perfect tense. Decide which one.
Ma'am, you have made up your mind about your future career when you
made. It's past perfect.
Yes, ma'am.
Yes.
Yes, ma'am.
And this is the question, the general question, which should start with the auxiliary verb. You is not the first word in the question. How can we make up a question?
Ma'am, had you made your mind?
Exactly, yes.
Yes,
You
ma'am.
made your mind. Okay. So the next is for Aman. Aman?
Yes, ma'am.
Number 6.
He has not completed his internship by the time he left his home country.
But it shouldn't be past, not present perfect. He had not completed, right?
He had not completed his internship by the time he left his country, his home country.
Thank you. Apeksha, the next, please.
Yes, ma'am. In 1960, a year after Roche first synthesized diazepam, Roche, along with Merck and Lundbeck, introduced amitriptyline to the market.
So I missed what was the form of synthesizer?
First synthesized.
It should be in the past perfect tense. After Roche had first synthesized diazepam and then introduced in the past simple. Okay. Well, now Yes, we'll miss this, and we'll start just with reading about how to just the steps that are necessary, how to take a psychiatric history, because this process is different from the Socrates model, which doctors apply when they talk to a patient, which have another kind of health problem. And now let us read about these steps, how to deal with psychiatric disorders. So, and let us listen to Misha. Start reading, please.
Yes, ma'am. Sitting to the history. Introduce yourself, explain to the patient how long the interview will take, and explain its purpose. Find out how the patient came to be referred and what his expectations are. Example about the treatment. If the patient denies having any problem or is reluctant to start talking about himself, do not hurry him. Try asking, how are you? What has been happening to you? What are the most important things? Another approach for the hospital patient is to indicate why the GP referred the patient and then ask what the patient thinks about this. Sit back and listen without interrupting. Nothing exact examples of what the patient is saying. Take more control after about 3 minutes to cover the following topics.
So this is important to keep in mind that, as Dr. Turner says, so the attitude to time in the conversation with a psychiatric patient is different. You should just should not interrupt and just wait. Okay, and so the next piece of information is for Nivas.
Yes, ma'am.
Read,
I'm
please.
presenting symptoms. Agree a problem list with the patient early and be sure it is comprehensive. Like, for example, by asking if we were able to deal with all these would things then be all right, or if I were to help you, how would things be different? Then take each problem in turn and find out about the onset, the duration, the effect on the patient life and family, events coinciding with the onset, the solutions tried and reasons why they failed. The next step is to inquire about moods and beliefs during the last weeks. And this is the difference from the mental state examination, which refers to the mental state at the time of interview.
Okay, so some of the questions, they just follow the Socrates model, but in some cases they are different. Well, and so the next piece of information is for Vandana.
Yes, ma'am. Eliciting the history. Specifically check for suicidal thoughts, plans, or actions. The more specific these are, the greater the danger. Discussing suicide does not increase the danger. Depression, low mood, anhedonia, unable to feel pleasure, self-denigration, I am worthless, oh, I wish I had not been born, guilt, it's all my fault, lack of interest in hobbies and friends, plus biological makers of depression, which is early morning waking, decreased appetite and sexual activity, weight loss, mania, symptoms of psychosis, which is persecutory beliefs, delusions, hallucinations, drug and alcohol use, obsessional thoughts, anxiety, eating disorders. Example, young women often not volunteered and important. Note compulsive behavior. Example, excessive hand washing.
So this is these are the steps how to elicit the patient history. The patient with a psychiatric disorder, which is very specific. And yes, unfortunately, we are short of time. That is why just let us focus on the final slide here of the presentation. This is about the taking the midterm 3 test. on the Moodle site. You should complete the test, and there are 22 questions in the test, and the questions are of 3 different types. Like true-false questions, there is a statement. You should decide if the statement is true or false. Then matching questions, like there are some terms and their definitions, and you should match them. Or the beginnings of sentences and the ends. And then select missing words, short story, and you should just, there are some gaps in the text, and you should click, and you'll see 3 words that are possible, or 4 words that are possible to use in this gap, and you should choose the correct place for each of the words. So the test is available now on the site, and it will, you'll see the time. It will just close in an hour and a half. But as far as you start doing the test, it will last for 30 minutes, and then it will close automatically. So you'll